Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rare case that challenges some common assumptions about salmonella infections in dogs. This case study, published in the Journal of the American Animal Hospital Association, details an instance of salmonella-related prostatitis and bacteriuria in a dog with a healthy immune system. This is particularly noteworthy because, until now, such infections were primarily associated with dogs on immunosuppressive medications. Let's set the stage. The patient was a 7-year-old male pit bull terrier mix who presented with a 3-day history of lethargy and anorexia. The dog's owner reported no significant medical history or medication use. The dog was fed a commercial kibble diet, supplemented occasionally with hard-boiled eggs and cooked chicken. During the initial physical examination at the primary emergency facility, the dog exhibited pain upon palpation of the caudal abdomen. A preliminary ultrasound raised concerns about a potential prostatic cyst. Blood work revealed a stress leukogram, indicated by an elevated white blood cell count, and a mixed hepatopathy, evidenced by increased alanine aminotransferase and alkaline phosphatase activities. Further, the dog had mild hyperbilirubinemia. Urinalysis showed isostenuria, polyuria, and the presence of bacterial rods. The dog tested negative for antibodies to Anaplasma, Ehrlichia, and Borrelia. Initially, the dog was prescribed carprofen and enrofloxacin and then referred to a tertiary facility for a more comprehensive evaluation. Upon arrival at the tertiary facility, the dog was assessed to be around 5% dehydrated and presented with hypotension. The dog was notably reactive and in pain during palpation of the caudal abdomen. A rectal examination revealed that the prostate was firm, enlarged, and painful. A repeated urinalysis, obtained via cystocentesis, confirmed concentrated urine with significant pyuria and the presence of numerous bacterial rods. An abdominal ultrasound revealed marked prostatomegaly, characterized by multiple echogenic fluid-filled cavitations, along with regional peritonitis. To gather samples for analysis, an ultrasound-guided percutaneous drainage of one of the prostatic cavitations was performed. While awaiting culture results, the dog's enrofloxacin treatment was continued. The subsequent day's laboratory results indicated a progressive hepatopathy and mild hyperbilirubinemia. Due to concerns about potential sepsis, the antibiotic regimen was broadened to include clindamycin in addition to enrofloxacin. However, because of financial constraints, the dog was discharged with a prescription for gabapentin, carprofen, mirtazapine, enrofloxacin, and clindamycin. The results from the urine and prostatic fluid cultures identified salmonella, with a count exceeding 100,000 colony-forming units per milliliter. The bacteria showed resistance to gentamicin and amikacin, but remained sensitive to enrofloxacin. Consequently, clindamycin was discontinued, and enrofloxacin was continued for 8 weeks. Once the salmonella diagnosis was confirmed, the owner was given specific guidelines to prevent zoonotic transmission, including wearing gloves while handling the dog's feces and urine. The owner was also advised to use disinfectant for cleaning and to limit the dog's interaction with immunocompromised individuals and young children. The veterinarians also emphasized the importance of seeking medical attention if any family members developed symptoms such as fever or gastrointestinal distress. 1 month post-diagnosis, the dog was reevaluated. The owner reported that the dog was doing well, with no apparent issues. The dog was only taking enrofloxacin, and pain medication and appetite stimulants were no longer necessary. A repeat ultrasound revealed persistent anechoic prostatic cysts. Follow-up blood work indicated that the previously observed abnormalities, including the mixed hepatopathy and hyperbilirubinemia, had resolved. A urine culture, obtained via catheterization, showed no bacterial growth. A recheck evaluation was scheduled 1 week after the conclusion of antibiotic therapy, but the owner did not comply. Instead, the patient was re-examined 1 month after completing the enrofloxacin course. A repeat prostatic ultrasound revealed similar anechoic cystic regions. Both prostatic and urine cultures came back negative, confirming the successful elimination of salmonella from the prostate and urine. In line with the American College of Internal Medicine guidelines, it was recommended that multiple fecal cultures be performed to rule out salmonella infection, given the low sensitivity of single fecal cultures and the potential for intermittent shedding. Although repeat fecal cultures were advised 1 week post-antibiotics, they were performed 1 month later due to owner noncompliance. Both serial fecal cultures were negative, confirming the absence of active Salmonella infection. Following the resolution of the infection, castration of the dog was recommended. Turning to the lab work, standard aerobic cultures of both prostatic aspirate and urine were conducted at an academic veterinary clinical microbiology laboratory. Both cultures exhibited pure growth of Salmonella species, identified through an automated biochemical identification platform. The urine culture showed a count greater than 100,000 colony-forming units per milliliter. The Salmonella isolate was identified as Enteritidis by the National Veterinary Services Laboratory. Whole genome sequencing further confirmed the isolate as S. Enterica subsp. Enterica serovar Enteritidis. Notably, the whole genome sequencing data revealed a close genetic relationship between the dog's isolate and 7 isolates from human clinical cases in New Jersey. However, the source of Salmonella enteritidis in those human cases remained undetermined at the time of the report. Now, let's consider the broader implications of this case. Salmonella infections in dogs typically occur through the fecal-oral route. Common sources of infection include raw diets, contaminated water, scavenging, and ingestion of feces from carrier animals. Risk factors include raw food consumption, recent antibiotic or probiotic use, rural environments, and exposure to livestock. The severity of the disease depends on factors such as the amount of bacteria ingested, the specific serovar, gastric acidity, and the host's immune response. In dogs, Salmonella infections commonly manifest as acute or chronic gastrointestinal disease, with symptoms such as fever, malaise, anorexia, vomiting, diarrhea, and abdominal pain. However, many infected dogs become carriers, shedding the pathogen without showing clinical signs. Studies have shown that Salmonella prevalence in dogs can vary widely, from 1 to 20% in pet dogs to as high as 70 to 90% in working dogs. Extraintestinal Salmonella infections are rare in dogs and humans, but have been linked to conditions such as pleuropulmonary disease, endocarditis, and urinary tract infections. In dogs, Salmonella has been associated with discus spondylitis and meningoencephalitis. This particular case is significant because it describes Salmonella bacteriuria and prostatitis in an immunocompetent dog that was not fed a raw food diet, a departure from previously reported cases. Existing literature includes a few case reports of Salmonella bacteriuria in dogs, all of whom were receiving immunosuppressive agents. For instance, one case involved a German shepherd treated with prednisone for immune-mediated polyarthropathy. Another described a Labrador mix who developed Salmonella prostatitis while being treated for thrombocytopenia and several other infections. A third case reported Salmonella bacteriuria in a boxer undergoing immunosuppressive therapy for suspected steroid-responsive meningoencephalomyelitis. In humans, Salmonella bacteriuria is more frequently observed in older individuals with underlying health issues or compromised immune systems. There are isolated reports of acute bacterial prostatitis and prostatic abscesses due to Salmonella infections in immunocompetent humans. Some of these cases have been linked to recent travel to regions with higher Salmonella prevalence. The route of infection is often unclear, but may involve hematogenous spread or ascending infection via the urethra. The fact that the dog in this study was not on immunosuppressive medications, consumed a commercial diet, and had no known exposure to livestock makes this case particularly intriguing. The authors suggest that the infection likely occurred either through an ascending infection via the urethra or hematogenous spread from the gastrointestinal system. Given that enrofloxacin can effectively penetrate the blood-prostate barrier, it was the chosen treatment based on antimicrobial susceptibility testing. This case underscores the importance of considering Salmonella as a potential cause of bacterial prostatitis and urinary tract infections, even in immunocompetent dogs. While it should remain an uncommon consideration, it broadens our understanding of the possible presentations and risk factors associated with Salmonella infections in canine patients. In conclusion, this case report serves as a valuable reminder that, while rare, Salmonella infections can manifest in unexpected ways, even in seemingly low-risk animals. It highlights the need for thorough diagnostic investigation and a willingness to consider less common differentials when faced with challenging clinical presentations. By expanding our knowledge of such atypical cases, we can provide more informed and effective care for our veterinary patients. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and, as always, Keep those minds inspired, hearts light, and tails wagging.